Hello again. My name is Dr. Ronald A, and I am a board-certified sleep medicine specialist and the medical director of the Southern California Pulmonary and Sleep Disorders Medical Center in Thousand Oaks, California. Today I'd like to speak to you about a disorder known as Restless Limb Syndrome, or more commonly known as Restless Leg Syndrome. This is a disorder that is manifest by an irresistible urge to move, and it can be any part of your body, not just the legs. Most commonly, however, it involves the movement of your feet or ankles. This can be as subtle as the wiggling of your toes, the flip-flopping or tapping of your feet, or just this general urge to move any part of your body. This is a disorder that occurs primarily when you're at rest, such as sitting in a chair, in your car, at your desk, on a plane or train, or most commonly while you're lying in bed prior to falling asleep. This disorder occurs more often in the early evening hours compared to the daytime hours. It is often but not always associated with some kind of an unpleasant sensation in the extremities. And this can range from anything from pain or discomfort, numbness, tingling, burning, creepy crawly sensation, bugs on the skin, or just this irresistible urge to move or a sensation of restlessness. Movement of the affected part of your body will offer you at least temporary relief. Oftentimes, a friend or family member will have commented at some time in your life to please sit still, or can't you stop doing that? Patients, on the other hand, are often oblivious to their movements. If the situation occurs where a friend or family member has pointed this out to you and you're oblivious to it, or it doesn't physically bother you, unless you have a complaint about it or are not sleeping well, nothing needs to be done. However, many patients with restless limbs also have a disorder known as periodic limb movements during sleep. This can be, again, a very subtle movement, as simple as a toe moving like that. Your bed partner is never going to complain about it. You're asleep and you're not going to know about it. But it can cause awakenings from sleep, leading to disrupted sleep and a complaint of daytime sleepiness. This disorder is more common in women and often runs in families. So you may have brothers, sisters, parents, grandparents, children who have this disorder as well. There are over 125 known causes for restless limb syndrome. About half the patients who have restless limbs have what are known as primary restless limb syndrome, where we don't know what causes it. In the other half, we can often find an underlying cause. Simple blood tests may be all that's necessary to make the diagnosis of a secondary cause for restless limbs. Sometimes correcting the secondary cause will correct the underlying disorder. However, in other patients, they still have abnormal blood tests, which we can then correct, but they will still have restless limbs because they ultimately had primary restless limbs. There are several classes of medications that are available for the treatment of restless limbs. Stay tuned for part 2 of my series on restless limbs to learn about the various treatment options that are available to you. So if you have symptoms that are suggestive of restless limbs, please check with your primary care physician or see a board-certified sleep specialist at an accredited sleep center for a thorough evaluation and the management of restless limb syndrome. More information can also be obtained on my website. Thank you again for watching this video on restless limb syndrome. Stay tuned for part 2 on a future video. And always remember, sleep well tonight for a better day tomorrow.